Okay, so I'm going to be doing a mouth and pharynx exam for the lab section of the Dr. Zhang PE class. You would need a wooden tongue blade and a good light source to do this. I only have a spoon instead of a wooden tongue blade because I don't have one of those available. And the good light source will be the flashlight. So first I'll put on gloves to do any inspection. Then I would inform my patient that I'm going to do the inspection, and I would be inspecting any suspicious ulcers or nodules, and I'm going to palpate any lesions. The inspection should be any the inspection should include inspection of the lips, the oral mucosa, the gums, the teeth, the roof of the mouth, the tongue, the pharynx, and then a special TMJ test. So the lips and the angle of the mouth, I'll be looking for color. The color should be a normal pinkish color. I should be looking for moisture or to see if there's any ulcers, cracking, scaliness, or clefts. There doesn't appear to be any of those. And everything seems to be normal with normal color. Then I'll be inspecting the oral mucosa, which are the cheeks and under the tongue. The color there should be normal pink. Again, I'm looking for ulcers, white patches, nodules, and also looking for the opening of a Stenson's duct and Wharton's ducts. So the color is normal pink there, and then under the tongue, the light source would help. And everything looks nice and normal in there too. Wharton's ducts and Stenson's ducts are going to be in the bottom and the top. And they look all normal too. No redness or swelling there. Next thing would be the gums. So I'd be looking at the color is normal, pale, or pink. Looking for swelling, bleeding, or ulcerations. And there's none of that. And everything is normal there. My normal number of teeth should be between 28 and 30. I have 28 because I've had all of my wisdom teeth removed. No plaque or decay at all in those. Both sets. The roof of the mouth will be the next thing. You're looking for the color and the hard palate, the architecture, clefts, swelling, or ulcers there. So nothing there, everything nice and normal. The next thing would be the tongue, sides, and undersurface. I'll be looking for color, size, nodules, ulcerations there. So everything looks normal in that. I would have the patient, I would then protrude the tongue, noting any deviation, and then I would ask the patient, to press the tongue against my finger against my cheek. So protrusion is normal, and also am able to press my tongue against my finger and my cheek bilaterally. The next thing would be the pharynx, which I'll use the blade or the spoon that I have, and I'm looking for the shape of the soft palate, the uvula, also looking for swelling and the positioning, make sure there's no lesions. Both sides are rising at the same time, to make sure that the uvula is not deviating to one side or the other. Also looking for the posterior pharynx, tonsils, enlargement, redness, swelling, and discharge of that area. So I'll stick the tongue out and I'll also say ah, which will then I'll be able to see cranial nerve 10 and the movement of the soft palate along with uvula deviation. Ah. Okay, everything looks normal there. Finally, I would inspect the alignment of the front teeth in sitting position. Okay. Then the patient would be supine if I had the patient, but again, I don't have a patient with me, so I'm having to do it all myself. So I'll be taking the tips of my index fingers and I'll putting them in front of the tragus, and I will open and close the mouth and move the jaw from side to side to push the lower jaw forward. So open the mouth, side to side, pushing the jaw forward. Looking for range of motion, tenderness, or clicking. With mine, I had a little bit of clicking on the opening and closing, but everything else was normal. Range of motion seemed to be about normal. When the patient, or when I'll open my mouth as wide as I can, there should be about 3 fingers lengths in between the upper and lower incisors. So have plenty of room for that and good range of motion there. So that concludes the mouth and pharynx exam for Brian Shepard.